Hello, my name is Emily Steen. Today, I will be discussing the relationship between soluble fiber and heart health. The specific research question I will be investigating during this video is simple. Does increased consumption of soluble fiber support heart health? To gain a strong foundation of knowledge among our viewers, we will first define what soluble fiber is. Fiber is a carbohydrate that cannot be digested or absorbed by the gastrointestinal enzymes. This is because of the specific beta-glycosidic bonds which connect the monosaccharides within these polysaccharides. Most foods contain a mixture of soluble and insoluble fibers. Soluble fiber dissolves in or absorbs water and can be broken down within the GI tract by the microbiota. This fiber benefits the body by regulating the body's component levels, including blood glucose and cholesterol. Soluble fibers are found in plants such as oats, beans, and fruit. Once they are broken down, they have the potential to interfere with nutrient absorption. They also slow down digestion and can treat negative reactions such as diarrhea to ingested substances. Fiber is not considered essential to bodily function, though it is beneficial to our health. Currently, consumption of dietary fiber is around 15 grams per day, which is below the dietary guidelines for Americans' daily recommendation of 25 to 38 grams per day. The relationship between soluble fiber and heart health is well known within industry. There are products across the board that offer to aid in dietary fiber intake. All of the products shown here utilize soluble fiber and make research-backed claims such as improves heart health by lowering cholesterol. But where does cholesterol come in? Cholesterol plays many important roles within the body. Excess levels of cholesterol, however, have been found to produce negative effects on the body. Concern arises when the ratio of high-density to low-density lipoproteins, or HDL versus LDL, is affected by diet. An increase in HDL cholesterol is a significant indicator of increased heart disease risk. The liver uses cholesterol to produce a helpful digestive juice called bile. Bile is amphiphilic and it aids in the emulsification and expulsion of fat and cholesterol from the body. Most bile is recycled within the body and is reabsorbed in the ileum of the small intestines to the liver. High fiber intake is associated with reduced risk of heart disease because of the association between soluble fiber and bile. Fiber binds to the bile and helps the body excrete it instead of reabsorbing the bile. This causes the liver to compensate for this loss by creating more bile, which requires the expenditure of more cholesterol. This, in turn, decreases cholesterol levels in the body. Within a practical range of intake, soluble fiber consumption slightly reduces cholesterol levels. Increased consumption of soluble fiber helps decrease the level of total and low-density lipoprotein cholesterol. Because increasing soluble fiber intake only makes a small improvement in overall health, more dietary and lifestyle changes are required to maximize heart health. One should limit their dietary cholesterol levels by avoiding foods with trans fats. Also, increasing consumption of omega-3 fatty acids and phytosterols can beneficially alter the absorption mechanisms for cholesterol. Following the dietary recommendations of consuming under 100 milligrams of cholesterol per day, it will ensure enough cholesterol is present to maintain bodily functions without increasing the risk of heart disease. In conclusion, increased consumption of soluble fiber does support heart health. Based on the aforementioned limitations to this method, increased consumption of soluble fiber should be applied in conjunction with many other lifestyle changes to ensure maximum heart health is achieved. Thank you for viewing this video.